Hey friend, welcome to part 2 of my prolapse surgery story. So I came to you recently and I told you about my experience with prolapse. I have 2 pelvic organ prolapses, and one is bladder and the other is rectal. And I, in my first video, went to see a urogynecologist and decided that we were going to treat it with surgery. So today I am here for a follow-up appointment. It has been 1 month since my first appointment, which is when we chose to have the surgery. For this appointment, we are going to do a Urodynamics test, and I'll tell you what that means. I'm Katie Huey-Harrison, founder and editor-in-chief of Undefining Motherhood. We're an educational site and community equipping you with the knowledge and information you need to do this mom thing your way. And today I'm talking about my prolapse story. What do we do when we get this issue after childbirth? It's different for everyone. Pelvic floor therapy is a great place to start, but I have landed, in addition to that, in a urogynecologist's office, and I'm going to be having surgery to repair my prolapse in about a month and a half. So today I am having what's called a urodynamics test, and what that means is that I had to come to the doctor's office with a full bladder, and we are going to go in and find out what's going on with my bladder, so she knows exactly what she's looking to repair during the surgery, and so that she can give me the best possible idea of outcomes that I can expect. So what this means is when I cough, when I sneeze, when I'm walking and I have bladder leakage, what does that look like? What is causing that bladder leakage? And then also, when I finish emptying my bladder, does it empty all the way? Or is there urine left inside my bladder that can't get out, and that's part of the reason for the leakage? So I don't really know what exactly this means in terms of surgery, but I know it's an important test. I am just following the steps. So I am going to go in and do that appointment, and I will keep you posted. So this is weird. Let me show you. This is the room for the urodynamics test, and this is my toilet. So I have to sit down on this chair, and there's like something turned on at the bottom here that's going to record I don't know what, and then they're gonna come in and talk to me about what I do next. Awkward. So here we go.
So like, again, for you, not a problem, but like people that have neurologic issues or MS, you can look at compliance of like, if your bladder is like not stretching appropriately, the green line starts to like go up like a mountain because your bladder is just like can't handle the amount of fluid in there.
Oh wow. I did it. This is so strange. So I'm out of my appointment, and here's what you need to know. It took about an hour in total. It was uncomfortable, definitely. Not painful. Weird, like pressure, weird sensations, feeling like I needed to pee and I couldn't. So part of what they did was they tried to fill up my bladder to the point that I would be like, I'm gonna stop on the side of the road, even if there's nowhere to stop. So, you know, sitting and kind of breathing through that, and then having to cough and bear down so they could see what was happening. Very awkward. Then when it was over, after about, I guess, 50 minutes probably, I think it would have been shorter had the computer system worked properly, but not a lot shorter, maybe a 45-minute process. After that, then I started having some bladder spasms, and so that was a little bit uncomfortable, but it was okay. And I was told that could be normal, that I need to take AZO, which we often take for urinary tract infections, the stuff that turns your pee orange, because it is an anti-spasm medication, apparently, that directly targets your bladder. She said for about 1 day, that and a burning sensation like I have a UTI could be normal, but if it goes past that, to worry about a potential urinary tract infection. For me personally, they also have gone ahead and called in 1 pill of an antibiotic for urinary tract infections as a preventative measure. This is not standard practice because I personally have an immunodeficiency. They wanted to do that for me because I am very, very, very prone to infection. Not an experience I really want to repeat anytime soon, and I'm glad I don't have to, but not a bad experience either. And really fascinating if you're interested in the data that they're collecting. They were measuring really interesting things like how pressure in my abdomen correlated to pressure in my bladder. So they could see that this was pure stress incontinence, not bladder spasms or anything of that sort. They also were looking at the muscles in my pelvic floor and what they were doing at this time, which sort of highlighted even more to me the importance of pelvic floor therapy for things like this. So that was really fascinating for me to get to see. What they were looking for, the major thing I found out, is whether I'm a good candidate for a bladder sling. So when I have my surgery, they're going to use my own tissue to kind of reposition all of the organs where they need to be. But then there is a question, an optional addition of doing a bladder sling when they do that. And what a bladder sling does is it kind of works supposedly like a tiny little extra muscle sitting underneath your bladder to help with stress incontinence. So you can do things like run and jump and cough and not have a minor accident. But not everyone is a candidate for this. So if you're having bladder spasms, if you're not able to entirely empty your bladder when you try to void, there are a number of different things that can say actually a sling is not a good choice for you. So this test apparently, and I didn't really understand this going in, was to find out if I'm a good candidate for a sling. So I will come back next week and I will see the doctor. Today I was with a nurse practitioner who was just delightful. And I will come back and see the doctor next week where we will go over full results of the exam. So I will see you then and give you more information about the surgery, what's planned, what's going on. I'm on my way to my Urogyne follow-up from the Urodynamics Test. We're gonna find out what the results were and what that looks like in terms of moving forward with surgery. So I should have a lot of more details after today's appointment. Driving obviously stopped at the moment in the rain, so I'm late, but I'll pop in with an update as soon as I'm reasonably able. Super frustrated. So I waited an hour and 15 minutes and then I had to leave because I have another doctor's appointment I have to get to that I called and tried to reschedule, but I can't. So I drove 45 minutes up here. So that's 2.5 hours when you include driving home to have to reschedule and drive back up here this afternoon. So basically my whole day is now doctor's appointments and trying to do this, but I couldn't get the other one rescheduled, so here we are. Women's healthcare can be really, really frustrating because there just aren't enough providers. Okay, so take 2 for today, kind of take 3. This is 3 weeks from my actual urodynamics test. I was supposed to come in the following week after it to get results, and then my doctor got COVID, and so we had to push it back and this morning, and then mess with that. So now I'm walking in for the second time in a day. I hope this is quick and easy. 5 minutes waiting and they got me in. Thank God. Here we go. All right, so Urogyne visit done, pre-op done. I'm having surgery soon. So here's what I found out. Basically, I am a really good candidate for a bladder sling. I've decided I want to do that because I really want to be able to do things like jump on a trampoline with Jack and not feel like I'm wetting myself. And by feel like wetting myself, I mean wetting myself. So that's really exciting. So basically how the surgery is going to work is she's going to go in and she's going to take my fascial tissue that usually would work to hold up my organs, and what she explained with the prolapse is that's kind of like come apart, sort of like diastasis recti. So she is basically going to use my own tissue to go in and like reconstruct it, pull it back over each other, and use that to lift my organs back up. So weird and cool. So what that means is she's not cutting. She said there will be some cutting that will just be excess tissue. So she said it's like if you gain a lot of weight and then you have the excess skin that you need to get rid of if you lose weight. It's the same thing. There's just going to be excess tissue when she does this, and so some of that will get cut away. But other than that, she's not really cutting. She's just constructing, strengthening with what she already has to lift everything back up. So that's why recovery is supposedly not too bad. That's really exciting for me. A couple other things she told me. She said basically you want to recover kind of like you would for postpartum. So I'm going to get more mesh underwear and perineal ice packs. And she also told me, this is the part I'm not excited about, that I'm going to have a catheter in me for 24 hours after I come home. So I'm going to have surgery. And my mom is gonna be with me and she's gonna drive me home. And then I'm gonna be home with a baby and a 5-year-old and a bag of urine strapped to my leg for a day. And then my mom's gonna take me back to the doctor and they're going to remove that catheter. It makes a lot of sense. She said, there's just a lot going on with your bladder here, and it can be really hard to get it back to normal. Most people who plan to have it removed in office end up not having it removed in office, that they're just not ready. So I get it, but that's the one thing I'm nervous about, the 5-year-old and the breastfeeding baby with a bag of urine strapped to my leg. But that's where we are, so I'll keep you posted, but I'm really excited to feel like my life is getting a little bit back to normal. So I have surgery, and then after the surgery, full pelvic rest for 6 weeks. So no sex, no baths, no swimming, hot tubs. My husband's yelling for me, so I gotta go. Don't forget to like, comment, and subscribe to follow the rest of the journey. Thanks, friends.